Watch your tone. This is Dr. Anthony Caliendo speaking to you this month about tone. Now, did you ever hear that when you were growing up? Watch your tone, right? We had our parents talk to us about that. We all know what that meant. But I want to talk to you today about a little different type of tone and what it might mean in different ways. Now, tone, as I've spoken about over the last few months in different videos, is very, it's indisputable at this point, the correlation between the tone of your nervous system or the imbalance of tone in your nervous system and really several types of diseases. You've got correlations right now with the tone in your nervous system being off with cancer, glaucoma, type 1 and type 2 diabetes, autoimmune disease, arthritis. It goes on and on, the correlation between what your body's doing and the tone. Now, to bring in an analogy, now imagine an instrument, right? A violin. You have these Stradivarius, these really expensive masterpiece instruments, right? But they're only as good as the player, right? So now you have a master violinist and they're playing this violin and they're a genius at it, but now imagine that instrument was out of tune. So what does the musician do? They go in and they tune it, right? Because the tone wasn't right. That instrument has a certain tone, a certain note that it's supposed to be playing. The same goes for us. We have a certain tone that we were meant to live in, a certain range, a balance. There's a certain tone we were meant to live, a certain note we were meant to play, a song to sing. And that's really why I believe we're on the planet, is to play our different tones, because we're all different, right? So we need to recognize when our tone is up or down, and that's why I wanted to talk to you about this. Now, getting back to watch your tone, many different things can trigger that. Tone of voice, right? How someone is speaking, someone's posture. Someone talks to you this way, the tone is different than if somebody's standing there like this, that's a different tone, right? Also, tone could be absolutely posture. Now watch, follow me here. Now, if someone's on the table and we see they're lying there like this with one shoulder up, their heels are really tight, one leg is pulling up. When I go to palpate the person or touch them, I'm feeling their spine and it's rigid. This is a certain tone, and we can recognize that. Yes, we also have diagnostic tools. We also have advanced digital computerized x-ray that can tell us about tone or correlate in some ways with tone. We also have electrodiagnostic imaging that tells us about tone. But we can also palpate and we can feel with tone, but we can teach that to you too. Now, last month we did a video on SRI, or those breathing and movement exercises that help you connect with your body and your body's tone. It was to help you lower the tone or get more of a balance, right? So we have ways of telling what's happening in your body, and we can release it, help your body release itself. But I want you to recognize in your life when you're holding more tension or tone. How about when you're driving? You're driving, some days someone cuts you off, it's not a big deal, but other days they cut you off, you want to jump out of the car and kill them, right? Someday, what's up with that? Some days you walk into the house and you're all happy and giddy. Other days you walk in and you're like, nobody talk to me, don't come near me, right? Because your tone, where you're at is very different. We need to check in with that. There are ways to do that. We're doing a workshop a week from last Monday, which is the 16th of April, Monday, and we're going to talk about your tone, getting you to watch your tone, right? So join us there. We'll have some food. If you have any questions, you can sign up for our newsletter, which is at practicewellbeing.com. That's our website. Just put your name and email there, and we'll make sure you get all of this. Leave a comment, like us. See you next time.